Have you ever felt that stuffy, blocked feeling in your nose that just won't go away, no matter how many cups of hot tea you drink or how many times you blow your nose? For many of us in our late 60s, 70s, and beyond, even a mild bout of nasal congestion can start to feel like a major roadblock to everyday comfort. It might seem like a small inconvenience, but breathing freely affects everything from our energy levels during the day to the quality of our sleep at night. Yet in countless conversations with friends and neighbors, there's a belief that circulates widely among older adults. All nasal decongestants are dangerous after 70. If you've caught yourself nodding along to that statement, you're not alone. It's easy to understand why people are wary. Most of us want to avoid any unnecessary risks with medications, especially if we're already juggling prescriptions for blood pressure, heart conditions, or diabetes. But is it really true that every type of decongestant is off limits once we pass a certain age? Imagine waking up in the morning with a stuffy nose that leaves you feeling groggy and fatigued. You skip your usual walk around the neighborhood because you're too tired and can't quite catch your breath. By the afternoon, you notice a dull headache setting in, and by bedtime, the blocked nasal passages make it hard to relax, robbing you of a good night's sleep. Over time, this simple congestion can reduce your motivation to stay active, interfere with your appetite, and leave you feeling uneasy about your health overall. The impact on daily life can be significant, and the solution might seem elusive if you believe that all over-the-counter relief options are strictly off limits. This matters because nasal congestion can be a symptom of seasonal allergies, a cold, sinus issues, or even dry indoor air. While it might seem minor at first, untreated congestion can strain breathing, disturb sleep, and in certain cases contribute to other issues like higher blood pressure. Correctly addressing congestion can help prevent compounding problems. Better sleep leads to more energy, which leads to more physical activity, which in turn supports heart health, mental clarity, and general independence. Now here's the transformation we're focusing on. By gaining an accurate understanding of how nasal decongestants work, which ones might be used safely, with proper guidance, and what practical alternatives exist, you can restore calm, restful breathing in a way that protects your overall health. Today we'll explore why not all decongestants automatically pose the same risk, what steps to take to ensure you're choosing a safe path, and how you can find relief using supportive, non-medication methods as well. You'll hear about seniors just like you who overcame the frustration of persistent stuffiness by making well-informed choices about their health care, and you'll discover simple strategies that can give you relief without fear or confusion. I've spent years talking with older adults about their health concerns, learning from their experiences, and following trusted sources of information in senior healthcare. While I'm not here to diagnose or prescribe, those are conversations for you and your doctor, I can share insights that come from listening to the best evidence available and seeing what actually works in people's everyday lives. If you've ever felt too worried to address your nasal congestion because you assumed all over-the-counter options were unsafe, I encourage you to stick around. By the end of this discussion, I hope you'll feel not only more informed, but also more confident about finding solutions that protect your well-being. Before we dive in, I'd love for you to reflect on your own experiences with nasal congestion. Maybe jot down what you've tried so far and how it made you feel. What has worked and what hasn't? Are there particular times of day or year when it seems worse? Making a note of these details can help you connect with the information we're about to cover. All right, let's unravel the common myths about nasal decongestants and explore a path to safe, comfortable breathing. The first misconception that often arises is the belief that all nasal decongestants, no matter the type or dose, carry the same risk for people in their 70s, 80s, and beyond. It's understandable why this myth has spread so widely. You've probably seen warnings about decongestants raising blood pressure or interfering with certain heart conditions. Perhaps your doctor or a friend warned you about a bad reaction someone they knew had. But one crucial piece of information often gets lost in the conversation. Different decongestants use different active ingredients, work through different pathways in the body, and come with varying side effect profiles. Lumping them all into a single dangerous category can keep seniors from getting the relief they might desperately need. Consider Hector, who's 72 and in generally good health. He's on a low-dose blood pressure medication, but has no major heart problems. Every spring, when the pollen count rises, Hector finds himself unable to sleep because of nasal congestion. His sister warned him years ago to stay away from all decongestants because they shoot your blood pressure through the roof. Frustrated and sleepless, Hector avoided every over-the-counter product out there, turning instead to just toughing it out. After weeks of poor sleep and watery eyes, he decided to talk with his pharmacist. He learned that certain topical nasal decongestants, like nasal sprays, can sometimes be used in short durations without significantly impacting systemic blood pressure. Because the medication primarily affects the nasal passage tissues, far less of it circulates throughout the body compared to oral decongestants. Under guidance, Hector tried a simple saline spray first, and when that wasn't enough, a short-term nasal decongestant spray. He monitored his blood pressure daily, maintained his usual dosage of medication, and discovered he could breathe comfortably at night with minimal risk. Hector's story shows that painting all decongestants with the same brush can lead us to miss possible tools that improve quality of life. Of course, caution is vital. If you have a history of arrhythmia, uncontrolled high blood pressure, or other cardiovascular issues, certain decongestants, especially oral ones that contain pseudoephedrine, could be riskier. The key is to differentiate between the types of decongestants and to work closely with a healthcare professional who can advise you on dosage, frequency, and the signs you should watch out for. An excellent step is to begin any medication conversation with your doctor or pharmacist. Mention the prescriptions, over-the-counter products, and supplements you're currently taking. Since many seniors manage multiple conditions, you'll want to be sure there are no interactions or compounding side effects. This may sound daunting, but pharmacists are often an overlooked resource and can be incredibly helpful in providing guidance tailored to your situation. Approaching it this way means you're not making decisions out of fear or outdated information. Instead, you're weighing risks and benefits with professional insight, ensuring you keep your blood pressure and overall cardiovascular health in check while still addressing that nagging congestion that disrupts your life. If you're following along and thinking, yes, but it's not just about blood pressure, I'm on other medications too, you're right. That concern leads into the next important point, the role of polypharmacy and how seniors can carefully balance medication use without resorting to blanket avoidance. At around 79, Linda found herself juggling prescriptions for her thyroid, cholesterol, and occasional joint inflammation. Every time she felt her nose stuff up, she panicked at the prospect of adding yet another drug to her daily regimen. Over time, Linda started to believe that any additional medication for any reason was too risky, fearful it would cause serious interactions. However, once she brought her medication list to her pharmacist for review, she discovered something surprising. None of her current drugs interacted dangerously with a short-term nasal spray or a mild oral decongestant, as long as she monitored for side effects like nervousness or an elevated heart rate. Linda's story highlights the nuanced nature of medication management for seniors. It's not about refusing all over-the-counter relief. It's about being thoughtful, informed, and supervised in your choices. The big takeaway is that not all congestion remedies are created equal, and the decision to use one should always factor in your overall health status. By distinguishing between short-term topical sprays and oral tablets with systemic effects, you can work out a plan that best fits your body's needs. If you're comfortable so far, consider sharing your thoughts in a journal or mentioning them to a friend. You might be surprised how many people in your circle are stuck in a cycle of misinformation, thinking no safe options exist. Let's keep going to uncover other strategies you can combine with or use instead of medication. There's another common misconception that if a doctor advises caution with one approach, say oral decongestants, then it must mean you have no other real alternatives. This is where non-medication methods can be a real game changer. Think of them as complementary solutions that can either reduce your need for over-the-counter drugs or eliminate it altogether, depending on your situation. Picture David, age 76, who has a history of mild heart issues. He found his nose getting especially congested during winter months when the air in his home was uncomfortably dry. Rather than reaching immediately for a medication, David started by adjusting the humidity levels in his house, using a warm mist humidifier in his bedroom at night, and taking short, soothing steam inhalations before bed. The difference was dramatic. He also tried a nasal saline rinse once or twice a day to gently clear out his sinuses. With these steps, David discovered he only needed a medicated decongestant spray occasionally, far less frequently than he expected. If you've been relying on simple tissues and over-the-counter drops without relief, consider this layered approach. Proper hydration throughout the day, warm showers to loosen mucus, and even something as simple as gently massaging the area around your nasal passages can encourage better airflow. Some seniors also find relief with herbal teas containing mint or eucalyptus, which can help open up nasal passages naturally. Another underappreciated trick is to elevate your head slightly when lying down. Using an extra pillow can make a big difference in how freely you breathe at night. The real value here is discovering methods that fit comfortably into your lifestyle without posing additional health risks. The benefits, both physical and emotional, are significant. Even mild improvements in congestion can lead to better sleep, and better sleep can profoundly impact mood, cognitive function, and energy levels. Waking up refreshed can mean having the motivation to go for that morning walk, meet a friend for lunch, or tend your garden, and the emotional lift that comes from feeling more in control, knowing you have a strategy that works without forcing you into an all-or-nothing choice about medication, can be just as meaningful. Overcoming that sense of helplessness about a health issue is a powerful step toward maintaining independence and self-confidence. For many older adults, blending these non-medication approaches with well-monitored medication use is the sweet spot. You might find that a combination of good humidity control, regular nasal saline rinses, and occasional short-term use of a safe decongestant is the perfect plan. Or you may discover an alternative approach, like warm compresses followed by gentle breathing exercises, that reduces your congestion to the point where medication isn't necessary. Remember, there is no single one-size-fits-all solution. It's all about personalizing your approach based on your health status and preferences. After all, your goal is not just temporary relief, but a strategy that truly works for you over the long haul. At this point, you might wonder, how do I ensure I'm picking the right combination of tactics for my unique circumstances? That's where communication with your healthcare team comes into play. So often, we only see our doctors or pharmacists for a few minutes here or there, maybe once every several months, and we never quite get around to asking the day-to-day questions about common issues like congestion. Yet for older adults, these so-called minor concerns can add up quickly when ignored. The key is to be proactive and thorough when describing your symptoms, and also to let your provider know what you're currently doing. Medications, home remedies, dietary supplements, and any lifestyle changes. This approach helps them see the full picture and offer more precise advice. A real-world example is Margaret, 80, who used to go to her doctor prepared only to talk about her arthritis pain, ignoring that nagging sinus stuffiness she assumed was inevitable. She never mentioned that her stuffy nose was waking her up at night or making her cranky during the day. It wasn't until her adult daughter noticed her snoring had gotten worse that Margaret finally brought it up. Her doctor then explained how untreated nasal congestion was contributing to restless nights, which in turn worsened her daytime fatigue and even made her arthritis feel more painful. Together, they decided on a plan that included a short-term, mild nasal decongestant spray, a review of Margaret's other medications, and a recommendation to try gentle yoga to improve her nighttime breathing. Within a few weeks, Margaret noticed that her sleep quality had improved, and she felt more energetic overall. We all have unique medical histories, and it's vital to avoid guesswork, especially if you have chronic conditions like hypertension, arrhythmias, or diabetes. Being open and detailed with your healthcare team about even mild congestion can prompt them to suggest safe alternatives or specialized interventions, such as extended-release formulas with lower doses, specific antihistamines that don't conflict with your existing medications, or instructions for how to use a nasal spray effectively without overdoing it. These professionals can also keep track of any subtle side effects you might not connect directly with your decongestant use, like feeling jittery, noticing a slight increase in heart rate, or sleeping restlessly. Maintaining transparency in your healthcare discussions doesn't just keep you safe. It also allows you to explore additional complementary therapies. For instance, an ear, nose, and throat (ENT) specialist might recommend certain breathing exercises or a device designed to open your nasal passages at night. Physical therapists can show you simple postural techniques to help with airflow, especially if you're dealing with upper body tension that restricts your breathing. By stepping up these conversations, you convert nasal congestion from a frustrating inconvenience into a manageable part of your overall wellness plan. So how do you feel about your own communication with your healthcare providers? If you haven't brought up your congestion concerns in a while, consider making it a priority in your next visit. Even noting down a few of your most pressing questions can be the difference between fumbling with discomfort and finally discovering a workable solution. And if you find it challenging to remember everything during an appointment, ask a friend or family member to join you and help take notes. This small step can ensure that your concerns about decongestants or any medication receive the focused attention they deserve. As we move forward, it's helpful to reflect on the deeper reason behind all these approaches: feeling safe and comfortable in our own bodies. When you're grappling with a stuffy nose every night or worried about medication interactions, it's easy to feel like your day is dominated by minor health annoyances. That nagging sense of vulnerability can seep into other aspects of life, from socializing to physical activities. This final segment ties everything together by underscoring the broader emotional and physical benefits of properly managing nasal congestion and adopting the strategies that keep you thriving. Take a moment to imagine what it would be like to wake up tomorrow morning breathing freely and deeply. Picture stepping out of bed without the dreaded sniffles, brewing your coffee or tea, and enjoying a clear-headed start to the day. Maybe you head out for a brisk walk, savor the morning air, or plan a trip to the grocery store with confidence because you're rested and at ease. That small shift in how you feel upon waking can ripple through every aspect of your life. By the time evening rolls around, you notice you're less fatigued, more willing to chat on the phone with a friend, or perhaps read a few chapters of that novel you've been meaning to finish. Sylvia, 77, experienced exactly that transformation. For years, she accepted her chronic nasal congestion as a normal part of aging. She rarely left the house without tissues, and her nights were a battle with restless sleep. Finally, encouraged by her grandson, she decided to address it head-on. She learned that a short-term nasal decongestant was viable because her blood pressure was well managed, and she followed that recommendation with lifestyle tweaks, using a saline rinse in the morning, running a humidifier at night, and doing gentle stretching that opened up her chest and improved her breathing. The changes didn't happen overnight, but gradually she found herself sleeping more soundly and feeling more upbeat during the day. She no longer dreaded the inevitable stuffy nose, which freed her to focus on more fulfilling activities like volunteering at a local community center. This newfound comfort has emotional benefits that shouldn't be overlooked. When we feel in control of our health, knowing we have options, a plan, and trusted guidance, it eases anxieties and fosters a sense of self-efficacy. Many seniors express that resolving a minor but chronic issue like nasal congestion can renew confidence in tackling other health goals. Think of it like a chain reaction. Dealing with congestion might be the first step toward better sleep, which then helps manage blood pressure more effectively, leading to more energy for exercise and so on. The outcome is not just a clearer nose, it's a more active, joyful, and self-assured version of yourself. If you followed along up to now, take a moment to think about what you'd like your life to look like a month from today if your nasal congestion were under control. What would you do more freely? How might your energy levels shift? Visualizing this scenario can motivate you to take the small but significant steps we've discussed. Talk to a healthcare professional, explore safe medication options if needed, try environmental and lifestyle adjustments, and stay consistent with whichever methods you discover work for you. When you start implementing these strategies, monitoring your options, working with your doctor or pharmacist, integrating non-medical methods, you open the door to feeling safer, more energized, and better supported in your daily life. A stuffy nose may seem like a small complaint in the grand scheme of things, but it's often the little hurdles that chip away at our sense of independence and well-being. By addressing this one issue with a smart, tailored approach, You set the tone for how you handle all aspects of your health moving forward, with knowledge, calm, and the confidence that solutions do exist. It's worthwhile to act sooner rather than later. Nasal congestion might be mild now, but waiting can intensify problems if your sleep suffers, your blood pressure rises unpredictably, or your energy for socializing dwindles. By tackling it now, you offer yourself a chance at greater control and comfort. Just imagine going to bed tonight with the assurance that you can breathe more easily, and you've minimized the risk of side effects or medication conflicts. You're giving your body the rest it needs, and that choice can help protect your heart, your emotional well-being, and your ability to do the everyday tasks that make life enjoyable. The next time you're at a drugstore or see a commercial for cold and allergy medicine, instead of instantly dismissing it due to fear, remember that you have options. It's not a black and white situation of all decongestants are dangerous for everyone over 70. Rather, it's a nuanced conversation, one that respects your unique health history and acknowledges the advanced medical knowledge available today. And you're not alone in this. You have medical professionals who can guide you, friends or family members who might share similar concerns, and an entire community of older adults eager to exchange tips and experiences. If you're ready to take the next step, I encourage you to do one or all of the following. First, schedule a chat with your pharmacist or doctor about your nasal congestion, bringing along your complete medication list. Second, test out one or two non-medication strategies, such as a saline rinse or adjusting your home's humidity, to see if they offer relief. Third, keep track of how you feel over the course of a week, your breathing patterns, sleep quality, and energy levels. You might be amazed at how quickly even modest improvements lead to a brighter day. Finally, if you know a friend who's also been struggling with stuffy sinuses, share this information with them. Being proactive about health is easier when you do it together, comparing notes and encouraging each other to stay consistent. Most importantly, know that you have the power to make these changes. Age doesn't diminish your ability to learn, adapt, or find solutions that serve you well. It simply means you have to factor in a bit more caution and wisdom, ensuring your choices align with your overall health plan. That's what empowerment looks like. Knowing the risks, understanding your body, and choosing what's right for you with the support of professionals and loved ones. In the end, it's about preserving and even enhancing your well-being in a way that respects your life experience and your future goals. You deserve to breathe freely, rest soundly, and enjoy each day without the burden of unnecessary worries about medication. By acknowledging that not all nasal decongestants are created equal and that safe, tailored options exist, you open a new chapter of comfort and assurance in your life. Take that first confident step today, and remember, better breathing is just the beginning of many positive changes headed your way.